Right away, we started to investigate and find out what is it that has to be done. Is there anything that can be done? Where's work being done on this? Who can help out? And that brought us to learning about the United Network for Organ Sharing, or UNOS. And that's a contracted organization to the Health Resources Service Agency since about 1984, as you see up there. And they established the criteria and the oversight and so forth for organ allocation in the United States. And the new system that they had implemented in May of 2005 did not accurately depict. I mean, it was a good system in many cases, a great improvement over what we had before, which basically was based on, and this was for all organs, everything from skin, retinas, everything was involved on this change. And so it was good because it used to be the longest person that's on the list would get the organs. And what they were trying to do was to set it up such that the person who was the sickest would get the first shot at them. But they didn't get it right for pH. Did not get it right. They had difficulty trying to describe at what point is that person sick? What do we measure? What empirically will show us how really ill and how bad of condition that someone is in with pH? They didn't get it done. And so the appeals process, which was in place, definitely didn't work for us. So we had to take some action. We weren't going to count just on hope, and we began to take some action. I call it Task Force Doyle, and the mission was to change hope into a verb and fix the inequity in the system, and we needed to do it quickly because there were people out there with pH that were not getting offers of organs because of this broken system. The folks that participated in Task Force Doyle, there of course included Ramona was on it. Retta Gerges had been working in this area for a period of time. Of course, Tom Lantos, our great champion. Reno was there. Gavin Lindbergh, who you just met up here a few moments ago. I was on it, and many other people helped us with this, and I apologize for leaving a name off. Well, what we did was we decided we were going to go right to the top and take our case right to the top concerning that. We went to see the Secretary of Health and Human Services. Unfortunately, he was traveling and couldn't get back for our appointment that morning, but instead he had his deputy CS, Mr. Alex Azar, and his number 3 person, Admiral John Aguinobi. They were very, very interested in listening to us, and we made a compelling case, and they said, we're going to do what we can to help. What can I do to help Carl, to help get this inequity solved? This led to multiple calls, teleconferences with such people as Dr. Duke, the head of HRSA, and finally we achieved relief. UNOS agreed to change the appeal process immediately and to work with us on the rest. That work continues today. Ladies and gentlemen, within 2 weeks, we began to hear from physicians that pH patients were getting offers of organs. Even better, I got to view it firsthand. Back around Christmas time, this past year, around 2 or 3 days before Christmas, I was with Harry Rozakis, a member of our board here. Where are you, Harry? Okay. We were over in San Francisco, and we were attending a support group meeting. At that support group meeting, the young lady that was running it said, Carl, Harry, there's a gal next door who's on the heart-lung transplant list, and it doesn't look like she's going to make it. Her parents are up there with her. It's very distressing. Could you go over there and try to say something for her or make her feel better? You know, it's pretty hard, but we couldn't resist. We needed to go see what we could do to help. And so we walked over and we walked into the ICU just like we owned it. He called himself Dr. Rozakis. I think that's what got us in. We went in, and as soon as I turned the corner and saw this young lady, I was deeply saddened because she looked so frail. I couldn't even hug her. She just looked like if you touched her, that would be it for her. Her mother was there, and clearly they'd been crying. In the background, you could hear Christmas carols going on. It was a very, very difficult visit. And I thought, gosh, what can I say to try to make them feel better? You know, Harry and I both struggled with it. We tried to give them the kind of the game face. And as we left, I think I said, I just have a feeling that you're going to get a miracle for Christmas. 2 hours later, they called us and told us that she'd been offered organs. She survived the operation and was home in 12 days, and I called her mother yesterday, and she's doing just fine. Even better yet, while attending a board meeting last year, I think about the 25th or 26th of February, while we were snowed in Washington, D.C., and no planes were leaving from Washington National, I got a call from my wife who said, "They just called for Megan at Stanford. They've got organs for her right now. You need to get home quickly." There were no planes taken off, and many of the board members that are here remember that that very difficult morning. It was a very difficult time for us. Well, I got there eventually to Stanford, and she'd already been through the operation, but then she experienced a real serious complication, and they had to take her back in for another 8 or 9 hours. And it was such a serious complication, she was in an induced coma for several weeks as she fought for her life. Well, there she is, and she wanted all this recorded. That picture was taken just hours after the transplant, and you can see all those pumps hanging up there. Heart and lung transplant. And this picture was taken by Dr. Z, one of the doctors that had taken care of her, and he was driving into work that morning after the transplant. He said, "Carl, the rainbow ended right at the hospital." This is a picture of a 2,500-mile house call. And the person that's looking in on her there is Robin Barst, Dr. Robin Barst, who played such a key role in keeping my daughter alive all those years. But many other people fought to bring Megan along after the transplant. You see these great people. You see Ramona up at the top, and Dr. Z, and another, the transplant surgeon down in the lower left-hand corner. But eventually, and very, very slowly, she started to improve. She had to learn how to walk again. One of her best friends there was Dr. Haroon in the lower right-hand corner. And the gal up in to the left in the red sweater, that girl was her college roommate at Seattle University who went to nursing school. And the moment that she heard that Megan had been called for the transplant, she was able to leave work, and she came down and stayed for 4 months with Megan, helping to tend to her at Stanford. Well, we made it home. In fact, that's Megan giving her brother a hug the day that we drove back from Stanford. And it was a very, very, very happy occasion for us, as you might guess. But let's go back to the beginning of this story. And I want you to know that we could not have just hoped that these organs would have been allocated. I don't believe it would have worked. When we found out that there was a problem in the system, and we actively pursued a solution to that problem, we were able to make organs available not only to Lynn Picone, the girl in San Francisco, my daughter Megan Hicks, but many, many other PH patients now. We've created a level playing field so that they could have that opportunity if they decided to take that route. But we couldn't just do it on hope. We changed hope into a verb. Well, ladies and gentlemen, we're very, very fortunate because thanks to this magnificent organization, PHA, we all have the ability every day to go simply beyond simply hoping to actually taking charge of our futures. There's a program to support you in whatever endeavor you wish to participate in. And never worry if it doesn't seem to you like it's much. Simply a handwritten note to your congressman will have an impact if we do it all together. Many, many great programs up there. The 435 campaign to energize Capitol Hill. There's PH Aware campaign, sharing your story with the media. Everybody can do that. It's easy. They're looking for information. We've got support groups participating and supporting a support group. We've got fundraisers that we can all participate in. We've got a great medical education program about to start, et cetera, et cetera, et cetera. PHA gives you the opportunity to take that hope and convert it to a verb. You know, ladies and gentlemen, brothers and sisters, hope is a marvelous thing, and we certainly have to have it on this journey of hope and discovery. But we can all and must turn that little four-letter noun that so much hinges on in our lives into a verb. Were it not for the 4 courageous women that once met around a kitchen table and decided to take action, all that you see here would never have happened. Let's follow their lead and not just hope for a cure for pulmonary hypertension. Let us together do everything we can to find one, and find one today. Thank you.